Welcome to Physicians Keepers, where we as a physician community tackle the challenges that are unique to us by creating awareness and finding solutions from our experiences. We also learn to look out for our fellow physicians to ensure that no one is left behind. I am your host, Dr. Ali. Stay tuned and enjoy the episode.
Good afternoon and welcome to our relaunch of Physicians Keepers, and I am so excited to have you here with me today. And we have a very special first guest who's coming in with us as we start this relaunch, and I'm just going to go ahead and introduce her so we can go ahead and get straight to the topic. I have with me Dr. Peju, and she would pretty much give us her own bio herself, but she is a physician, executive, and founder of Leadership MD, who helps healthcare professionals build executive presence, lead confidently, and rise without burnout. Her current specialty is internal medicine. So I'm just going to leave it over to Dr. Peju so she can tell us a little bit more about herself.
Thank you so much. Such a pleasure to be pioneering the relaunch of the Physicians Keepers. I'm so grateful to be here. Just briefly about myself, I'm an internal medicine physician. My love for medicine started at the age of 7, and I continued to pursue that fiercely until I became a hospitalist and enjoyed that career. Did it for about 5-6 years and then moved over to the non-clinical side as a medical director of a health plan. And I sort of combined everything together. Right now, I'm a mom. And I got into leadership for physicians largely because of my own journey. I evolved over the past couple of years from the, residents, starry-eyed, very ready to see patients, to sitting on the executive side of things. My evolution made me realize that what we have in medicine is really a leadership gap. We showed up with the title and somehow didn't step into the identity of a leader. And that mismatch, I believe, contributed significantly to burnout for most clinicians that I speak to, myself included. And that's really the story behind Leadership MD and what I do today.
So how did you make that transition, though, from clinical medicine to stepping into a leadership role? Because, as doctors, a lot of us, and I'm not excluding myself, we like to stay in our zone of comfort, right? And medicine is such a long course that when you're in it, especially when going through med school, it's like you just want to just know about medicine. Like that's just all you want to be good at it. How did you navigate that transition from saying, okay, I know I love clinical medicine, but I think I can do great at leadership? Like, what did that look like for you?
What I say so quickly in 2 to 3 minutes, it's more like a decade long of, pivoting and repivoting and praying and asking for clarity. So I don't want to make it sound like it was just a snap. It was definitely a snap for me. One of my biggest drivers for becoming a clinician and a physician really was, access to care, poor access to care in Nigeria when I was growing up. And that really sits at the heart of what I do still. What I did realize after during medical school was that I liked seeing patients, but I was limited by the number of hours I had a day. And one thing that stood out to me was that I was in the outpatient track, and after residency, I didn't want to be in the outpatient track anymore. And how did I make that conclusion? I said, if I practice medicine the way I want to practice medicine, most employers will find me ineffective. I would not be able to generate the amount of money that they would want from me. And I concluded at that time that I was going to just go into hospital medicine and do shift work. And of course, I was having children, they were younger. So it was better for me at that time. Now, this transition to non-clinical medicine, though, came because, number one, I wanted to sit at the position of policy. You make one decision one patient, that's all you get to do in 15 minutes. But imagine sitting on the side where you can help rewrite policies, and that policy will affect thousands of people just because of that, of the position you sit at. Really, that was my driver. And I also realized quickly that I couldn't understand medicine without understanding the people who paid for medicine. So I felt like there was a big gap in my journey so far, and really getting into the health plan side of things was important to me, for me to be able to achieve that holistic view of medicine. And one thing that stood out though in clinical medicine for me was, because the patients were not exchanging money for value, most of the time they didn't understand the value because the insurance paid for it.
Yeah.
Right. So, and you find that in communities where they pay for it, it's a little different. So I just wanted to make sure that I understood that part of it. Now, in terms of leadership development, let me tie back to my story, how I started. I realized that so many of us were leaving medicine. Moms with little children. It was just like, why don't you just be done? And I didn't leave medicine at the time I left medicine because I was burnt out. No,
Yeah.
I was not burnt out, and I still am not burnt out. However, I realized that if we continue to have such massive exodus from clinical medicine, it really then leaves us with the experience, the most experienced are always out. And I didn't like that. So my goal is essentially is to help physicians embrace who they are, their leadership identity, not feel like medicine is getting taken away from us, but that we are the medicine, right? We are the people. We are the ones delivering the value for money. Every other thing around us is an entity, but without the clinicians serving the patient, there's no clinic, there's no outpatient practice, there's no hospital, and we don't really know who we are. And that's why we get to sit on the receiving end of things. And once we get that leadership identity together, honestly, however you decide to practice medicine, you will find more joy, more fulfillment, and that legacy impact, which is what most physicians want. That's what drove us to medicine. Anyway, I answered your question in a very long way, but I think I did.
So how did you switch the mindset? I mean, I know you said it was a whole journey getting there, but did you feel like when you were there, like when you're about to step into the road, did you feel like you were confident enough? Did you feel like you had all the skills you needed? Or like, how did you develop those skills to feel like, because, one of the big things with physicians, right, is that we like to be perfect at everything, right? And if we're not, we start to feel like we're imposters. It's like, I'm at this table, but I don't think I'm supposed to be here, right? Because I don't know the length and breadth of this. Like, I don't know the science behind it. I don't know the specifics, because, we like our specifics, we like our stats. So how did you, like, what did it take for you, like, getting all that knowledge to say, I'm at this table and I belong here? Like, my voice actually matters. Like, I know my stuff. What did that look like for you?
So, I will redefine imposter syndrome by saying that it's a chronic illness, right? It's a chronic illness, which means that you got to be on something for it.
Yeah.
It's like anytime you decide that you don't want to be on something for that chronic high blood pressure, you're just waiting for an hypertensive emergency or urgency, right? So I've accepted it. I don't run away from imposter syndrome. I actually embrace it. I'm like, you know what? You're my partner in crime. Let's do
Yeah.
this, right? Because what it tells me is that every time I'm stretching, I'm going to feel uncomfortable. It's like when I'm helping my children with like long division now or like addition. Of course, I don't feel imposter syndrome there because
Yeah.
I mean, we've been there, done that. So
Yeah.
imposter syndrome is really like a sign of you're stretching into some uncomfortable terrain, and that's normal. You're normal. You're feeling it. So in terms of the mindset shift around it, I don't think I always feel like I got it together, but I don't let that stop me. I think the training for physicians, unfortunately, had to do with get it right, get it right, get it right, and do this long education for you to get the degree. And then you should have been trained enough to not get it wrong.
Yeah. Yeah.
I know so many people that one get it wrong moment was all they need to actually just hang up the stethoscope and say they're done.
Yeah.
So what helped me a lot is really having an entrepreneurial spirit. And we have multiple businesses in our family, and watching us do that and learn from it really helped me to realize that perfection was not the goal. The best businesses are always iterating. What can we do more? What's our competitor doing? So that perfection spirit is not there. It's more progress. So I still don't feel prepared every day I work into, go into the office. I always don't feel like I got it together, but I make sure I learn from the version that I did add yesterday. And honestly, my goal is just to be better than the version of me the day before. Now, there are courses that I took, there, feedback. I'm very cerebral. So I usually sit back and say, that conversation, I could have handled it a little differently. What skill am I lacking here? I think my communication, I need to work on that. I tend to speak fast, for example. I realized that when I was giving presentation to the executives, speaking fast tends to mean that you're nervous and you're not confident about what you're talking about, despite having all the data. So I had to go back and say, hey, let's take a communication class. So all those things I started working on, and I don't think I'm a final product yet. I think you're part of my journey. I'm part of your journey, but just embracing the fact that you don't have to be perfect. Progress over perfection, I think, is the biggest mindset shift for me. That's what gets me moving, despite the fact that I may not have it together.
That's awesome. That's awesome. Now, what makes physician leadership different from all other spheres of leadership, right? So, especially in the healthcare sector, like what, how is it different when a physician is in charge versus other folks who are probably not trained in the medical sphere? How does that impact healthcare? Like, why should we be the ones championing this?
So, number one, it's very challenging when physicians are not stepping into leadership because they don't know how to negotiate for themselves. And not negotiate in terms of money. I know a lot of people think about that. Not negotiate in terms of money, in terms of value. As a physician, when we know what we bring to the table, right, we center everything to make sure that the person who generates the biggest revenue or the direct. So let's put it this way. If a physician doesn't see patients, the secretary doesn't get paid. The building doesn't get paid. We don't pay for mortgage. We don't pay for our EHR. It's to that level that you need to know that your ability to sit in front of a patient, your prescriptive ability is what keeps this entity together. Everyone else works for you.
Sure.
We don't see it like that, right? We see it as we work for the CEO or the CMO. But when physicians are in charge, it actually allows us to protect the people who are sitting in the position of generating the biggest revenue. It allows physicians to get protected. The idea of burnout is almost like, as a mom, you understand, if mom is sick, the whole house is sick, right? So
Yeah.
if you want to make sure the whole house is running, make sure that mommy is not sick.
Yeah. Yeah.
Make sure mommy sleeps well. Make sure mommy rests well. Make sure mommy doesn't feel like she needs to quit. Because if mommy quits for 24 hours, the house is upside down.
Yeah.
And that's kind of what we're seeing in medicine. When physicians are not seen as the leader that they are, they're not able to speak for other physicians. It doesn't mean that I believe in collaborative leadership. So I'm not trying to look for an autocracy where physicians are the bosses and everyone else is like at their beck and call. No, but it's really protecting the people who sit in front of the patient and get value. The physicians are the one who are billing, who's generating revenue. They're getting the procedure done. They're seeing the patients. They're talking to the patient. We want to protect their time doing the most valuable thing. And when they don't feel like they're in leadership, when they don't feel like they're in control, they leave. Now, what happens when they leave? That entity struggles a lot.
Yeah.
So
Yeah.
no matter what, when physicians don't rise into leadership, we lose healthcare as it is. And for me, that's a disaster because in the long run, we're going to see the impact of having physician moving to non-clinical roles and really just having the landscape of medicine change altogether.
Kind of like what we're seeing today. Yeah.
Yes, yes,
Yes,
exactly.
absolutely. Now, what leadership skills would you say that, even if a physician is saying, look, I don't see myself, as stepping into a leadership role, but what skills would you say are necessary just from a baseline standpoint that every physician should have to at least take on a leadership role?
I think the biggest one will be problem solving. And we're already very good at that. Believe it or not, the
That's what we do
temptation
on a
to
daily basis.
thank you. So the temptation to get another degree is very, very high for physicians, right? Because we worked so hard to get this degree, and once we get the degree, we got the title. So you'll find physicians saying, I need one more course. I need this certification from Harvard, from Yale, from all these places. And then, or I can now be a physician executive. I need to get this CPE and this, you know, we're always chasing for those additional letters, but you already have it in you. And that skill translates, which is problem solving. That means when you see a problem, don't just delegate it and say, you know what, let leadership fix it. Like you are the leader. So when you own, yeah, you are the leader. And it's that lack of leadership identity, I think, that causes us to struggle. Because if I have to solve a problem, I will always solve it from a physician's lens.
Yeah.
Now,
Yeah.
if I leave it to other people to solve it, they will always solve it from their own lens. So when we say medicine, is being taken away from us, we may have just sold it away, right, on a
Yeah.
platter, on a
Yeah.
platter.
Yeah.
So I think the biggest skill is problem solving, which is I see a problem, I want to solve it, whether I have the title or not. It may be as simple as staffing. Staffing is not working because around the holiday, everybody wants to get time off. Can we design a better model during the holiday where even if we have to pay double, that's all right. Let's pay double to our physicians in-house so we don't have to use locums, because when we use locums, they don't have as much buy-in. But then the physician coming has to feel like they are well reimbursed for that time in.
Yeah.
So it's as simple as that. You owning it and not saying, oh, secretary, worry about that. I have better things to do with my brain. I just want to see patients. I just want to see patients is essentially how we lost medicine.
Yeah.
So
Yeah.
you need physicians sitting in leadership role to always think with that lens. So problem solving would be the biggest for me.
Okay. Awesome. What leadership lesson do you think you learned the hard way?
Ooh, I feel like I learn a lot of lessons every day, but now I have to choose one.
What was the most challenging thing for you in terms of stepping into that role? Do you feel like, oh, maybe I should have done this a little bit differently?
I think it would be messy execution. Just like being okay with messy movement. Perfectionism, because of the stakes that we deal with in medicine, it really grooms us to make sure that we've dotted all our I's, crossed all our T's, tested everything possible before moving forward.
Yeah.
In leadership, and I also work with some entrepreneurs as well. And it's the same thing. Leadership skills cuts across, whether you're in a career or as an entrepreneur, is still the same. In leadership, you're going to learn how to move forward with minimal information. And some of those, I may have had some situations in the past where, I could have just moved forward. There were people looking at me to just lead. And even though I don't have all the data together, all I needed to do is say, based on what I have, it's not the whole picture, but I'm going to move forward. There will be mistakes. There will be lessons to learn, but we're going to learn from it. So I had situations where I ended up not making a decision on time, and that decision made me look like I didn't know what I was doing.
Yeah.
But
Yeah.
the biggest lesson was be transparent with what you know, but make messy movements anyway. But just be transparent about what
Yeah.
data we have, what could happen, but we don't want to waste time by not making a decision at all. So that would be the biggest one for me.
Yeah.
Because you
So we
won't
get
always have everything together.
where we get stuck in the analysis paralysis stage is like, if I don't know the outcome of this, like
Yeah.
if I can tell that this is gonna come out this way, then maybe I'd rather not do it. And it's that, it's that story we hear all the time, especially in this era of upgrades, where it's like the iPhone came out and they were like, if it was so great, why are they upgrading it like every 6 months? It's like a new version. It's because they were not afraid to like, okay, let's test this out first, and then once we take that step, then we can know, okay, what worked, what didn't work, retrace our steps and see what we need to improve. But if you never actually release the product, then you don't know where the revision, so to say, needs to come
Is
in.
needed, right? It's almost like they sold us a defective iPhone 1, right? But Sometimes you need to get your minimum viable product out, get humans using it, and
Yeah.
you learn from it.
You learn from it. Awesome. Awesome. Now, how, we know burnout is a big thing in terms of, the
Oh, yeah.
physician set circle. How do you expect a physician, or what advice would you give to a physician who's dealing with burnout, but is still expected to lead and perform? Like, how does that work?
So I'm going to share a personal story around that. And this is my belief that you cannot keep pushing when you're against a wall. Something will give. And sometimes it'll be you. Sometimes it'll be you. So the first thing I would do is take a break. Take a break. And you have to have a level of abundance mindset around that, because when people think of breaks, they think, oh, they're going to think I'm weak. And if they think I'm weak, then they won't offer me the opportunity in the future. Or I just don't want to lose a hold of this position that I have. But sometimes the best growth is really from you letting go. And that's exactly what I did. I had a leadership position that was really, really draining me. It wasn't in a clinical setting, it was a non-clinical setting, but leadership is leadership everywhere. But I had to fire myself from the job. And I had to gain the audacity to say, you know what? I'm not giving my 100%.
Yeah.
I know that I'm not giving my 100%. And these people deserve 100%. In this role, I deserve to give my best because I don't chase title, I chase impact. So when
Yeah.
I'm not seeing the impact, I fire myself from the job because the version of myself that I need to get results, I don't have it right now. I'm running on low, I'm running on empty. And it was not an easy thing. It was
Yeah.
not an easy thing, but I did it. I'm very, very grateful, but because the person who's running that role now, I'm still supporting them, but they're
Yeah.
just so well fit, well rested, have clarity, and can think through. So when you're dealing with burnout, sometimes you don't want to roast yourself out. You're already burnt. Don't roast yourself out. Take a break. Step back from it. And whatever that looks like, it could be, having someone interim in the role while you re-strategize, but take a break and really understand what the source of burnout is. You may have three little ones that are under 5, and that's why you're burnt out. Maybe you need a different setting to express your leadership. And maybe you even need to be an assistant for a season and support someone else who has the bandwidth for it. So burnout, start with taking a break. And if you realize then that this job is not the best for you, this role is not the best for you, take a break. Have an abundance mindset though, that somehow when you are a leader who knows who they are, you will always lead. You will always lead. Whether
Yeah.
they give you a title or not, you will always lead when you're a leader because you will find a problem to solve.
Awesome. Awesome. Where do you see the landscape of physician leadership like go in the next 5 to 10 years if we continue in this trajectory that we are, where we are like, I just want to do medicine. Like that's just let me just do the medicine and let someone else. What do you see happening?
I think we'll definitely have more exodus of physicians from the clinical space. Um, it's even disappointing to see that sometimes physicians are even getting paid more in non-clinical roles. So you see that it then becomes a no-brainer. They've invested so much. Clinical space is toxic for them. It's not working out, and they're going to just have more exodus towards the roles that pay them well, supports their lifestyle, and they may even have more respect in non-clinical roles than in clinical roles. So that will continue to happen, and I think as a nation, that's not something we want. I don't believe in, I believe in collaborative leadership. I think I've said that
Yeah.
enough. So I'm not looking for a system where physicians are just, whipping everyone else into order because they're the master. That's not the goal.
Yeah.
You need good nurses as much as you need good doctors. So
Yeah.
it's really a collaborative team-based approach to make medicine work. But physicians are just a pivotal part of that role. And if they continue to move out, I think as a nation, we'll struggle to keep our skills in medicine. And I don't know, in medical school, you may have experienced this where you have a volunteer physician who's 75, 80 years old. And we had a few of those that just came to volunteer in the medical
Yeah.
school.
Yeah.
I absolutely enjoyed working with those physicians. Their view Just the fact that they're even very like touch-based examination, the way they examine patient was different. Now we're very heavily dependent on technology. But
Yeah.
that's that's what happens when we lose those people. Then medicine really becomes a touchless field. And
Yeah.
it's not good in the long run. It's not good in the long run. So I would hope that we will really embrace our leadership identity and take ownership for the career that we worked so hard, so long to get, and not throw it out because of this leadership gap that we have.
Yeah, I'm even inclined to think that we need to start even that mindset shift, even from med school.
Yeah.
I think there needs to be some medical schools that would have their student exposed early to leadership, because one of the things that I see a lot is, with medicine, like I said, the streamlining of thought, streamlining of processing, where if you were exposed to certain things earlier, it'll be easier for you to embrace it down the line. So I think even down to the level of med school, say, look, you can be more than a doctor. Like, that's not the only cap you need to wear in life. Like, you can definitely be more than that. So I think that will, I mean, in the future, if we want to avoid that mass exodus, it needs to start like, and younger physicians need to see like older physicians in that leadership role. It's like, oh, so a doctor can actually lead this. Like, how did they get there? It's like, oh, so if they can do that, that absolutely means that I can also, like, yeah, I can also get the skills to do that. So I'm hoping at some point in time that that's kind of a culture that can be started right from, the early onset of training, so that right from the get-go, like I said, residency, they would explore those options, and see what's out there for them, and then gradually keep building on those skills until they get to that point where they can actually exert the skills, and not wait until, oh, there's a leadership role here. It's like, oh, there is.
I'm
Well,
not
I
ready
don't
for this.
know. Because they didn't feel like they were prepared. But if they start preparing early, I think that that would help us a lot in the medical field. Now, can you have a program, right?
Yeah,
Like a coaching program for
correct.
physicians?
Correct.
Um, Walk us through what your program covers and how it's different from others. Like, if someone wanted to join your program, like, what can they expect from it?
Thank you very much for asking. So I have three pathways. Let's call it two for now. And the two pathways is the one-to-one clients who work with me one-on-one. We meet weekly. That is a little bit unstructured because I focus more on the biggest deficit that the physicians may have. So I have clients who are struggling a lot with time management. And rather than me walk them through the individual curriculum when they're not ready to move forward, I actually stop and say, you know what, over the next 2 months, we're going to get you better at managing time so you can document and chart on time. Because the leadership role you're looking for, if you're already working 12 hours a day, you can't do it. So we focus on that. Some of them is how to get visible. So we focus on that. So one-to-one clients, I work with them over a year long and get that result. For the Leadership Accelerator, that's a 6 weeks program where weekly we all come together and really, I already have pre-recorded modules that I have them walk through, and then we do the workshop together in class. So you don't have to feel like you have homework to do. There's no homework. We work together because I know we're busy, and that idea of homework really doesn't work. That we
Yeah.
left that in high school. We
Yes.
work together and we take away. So the first week we work on the leadership identity and then the mindset of a clinician and how you can evolve into a clinician leader. So we walk through that in the first week. The second week, we do the Power Speak module where we teach you how to communicate your value in a way that is succinct, makes sense, and someone can meet you and in 1 minute they can get to know what you do. And a lot of clinicians really struggle with that because they just go on and ramble about, if you're talking to the CEO of a hospital, they may not really care the antibiotics that you put the patient on for cellulitis, right? They're thinking, how can you add value to the
They bring
hospital?
money. How can you? Yeah.
Correct. So you want to speak to the right person in the right context and know what they need to hear. So we work on that the second week. And then on the third week, we talk about visibility, which is how to be the physician leader who is known because nobody follows people that they don't know.
Sure.
I make a joke all the time that the only leader that tries to hide is a secret cult leader, right? That's the only leader that like nobody knows. Like we just know there's a leader somewhere, but like you don't know where they live. You may not even know their real name. But
Yeah.
that's not who we are, right? So you want to be a physician who is known for what you do. So I walk them through a quiz, a visibility quiz, and they take the quiz, they get a score, and based on the score, we work on our action plan, and that's the third week. The fourth week, we walk through our evidence bank, what you're doing right now that crosses over. That's a lot of challenge for physicians when they're like, "I'm not good in leadership." I'm like, well, yeah, but you've been solving problems all these years with patients. You've been dealing with patient family, nurses, coordinating care. You're a leader. You just
Yeah.
didn't have the evidence to show you. So we walk through the evidence, we walk through their credibility so that they're more confident in saying that I do this. And then we wrap up the program with our 90-day leadership plan, which is who you're going to network with. You identify sponsors, you identify anchors and amplifiers within your network, and we map out in 90 days how you're going to move from point A to point B being, an impactful leader within your organization. So that's the 6 weeks program. It goes by fast. I'm in the process of actually increasing the time because there's just so much to cover, but it's 6 weeks for now. So those are the two pathways that people work with me. And I am in the process of finalizing building a slide deck card to actually
Yeah.
help residents and medical students. It's micro coaching. Yes, I'm
Yeah.
glad you mentioned that. It's really a desk-based calendar that you flip through over 30 days. And each day you get some mindset shifts. You look at that reminds you of how you can evolve as a leader. And there's a QR code that you scan. You'll see a video of me over 2 minutes, just coaching you through the theme of the day. And we do that for 30 days. It's pocket size, feels like pocket medicine, but it's
Yeah.
pocket leadership. And that is still in the, product
The
development
word.
phase. And that should be coming out in July, August when the new residents
New residents.
start and then new graduates. So I'm excited about that.
That's awesome. That's awesome. Now, what outcomes can have you seen from your program? Like, so the physicians who have gone through, like, can you share any like success stories or kind of like highlights that made you be like, I did a good job in training these folks?
Absolutely.
Yeah.
So the biggest one for me would just be there's so many. I have some testimonials on Instagram that people can check out. But one of them is just number one, being identified. One of my clients got identified as the chair of a committee, infection control committee, which was one of her goals. So she got identified and she's currently getting prepped to take over that position next year. So that was one very impactful win. The second was documentation. So when people think about leadership, the first thing is, I don't want more work. I don't want more work. So working with someone like me to help you see that actually you're not working more. You're just working in a meaningful way. And if you cannot manage your time, you will struggle with that.
Yeah.
So I had one physician in particular who struggled with like writing her notes on time. And that was a big deal because nobody gives physician more work
Yeah.
when you're not
When you
documenting.
show up in the red. Yeah. Yeah.
Yeah, exactly. The practice
Yeah.
manager is talking to you, your notes are not done, people don't know what your plan is. So we developed a system where you have your own internal metrics where your notes cannot be open more than 3 days for outpatient notes. And that's been working, right? Ideally, we want it closed on the same day, but this is someone who struggled for, months. Notes are not finished. We moved that to 3 days. And that was a big win. And she's referring one of her other physician friends over because of that. Because even though the role is going to start next year for her to take on the infection control, nobody wants to feel like they're drowning. Leadership should empower you, not take away from you. So that was a big win. The other thing is that people gain more audacity to even be able to state their value. I had a physician friend who changed jobs during one of our cohorts, applied for a non-clinical role as a medical director at a health plan, interviewed for the role. I prepped her through it, got a $40,000 raise from a previous role, and started the job this week.
Oh,
And the biggest thing for her was that she was finally able to pull up her evidence together because we talk about an evidence vault, which is all the things you do that you think they're not meaningful because it's just I'm just a doctor. No, we pull them together. And imagine before an interview you sit and see all the wins you've got. and you're able to actually say it during interview. I
Yeah.
saved my company $100,000 because I did A and B and C. So succinct, so clear. They're like,
That
we
boosts
want
your
you to hire.
confidence. Confidence
Yes.
booster. Yeah.
And she interviewed in the morning, got an offer in the evening. It was powerful. So these are just some wins. Definitely check me out on Instagram. I have some that I have already posted on my profile for you to see.
Awesome. And I would make sure I include your links in the show note because that was the next thing I was about to ask you is like if someone wants to connect with you or learn more about your leadership program, like, where do they do that? So I would definitely I mean you can say that around, but I'll make sure I put in the show notes so that they can connect with you.
Absolutely. Yes, Instagram at Leadership MD. And I'm on TikTok, but I'm struggling with TikTok. It's not my most natural place to be.
It's a language that needs to be learned.
I don't understand
I
it.
still don't get. Yeah, I'm struggling. I'm like I'm in a baby blah blah stage with TikTok.
I can't keep up. I
I
have a
don't.
virtual assistant, but I'm like, don't worry about TikTok for now. So largely find me on Instagram at Leadership MD, or you can email me at Dr Peju, DRPEJU at thepowerhouseleader.com. Those are the two ways to find me.
I think and I think one of the best breakouts in TikTok is dance. You dance,
Well, I will not be dancing.
and
So
that's what I was like. I don't know that I can do that yet, but we never know. Let me not say what I'll buy. Get to back me back in the future. So
right, right.
yes, yes. So, if someone's listening to you and they're like, okay, I think I want to step into that role, where would you advise them to start? Like, what would you tell them first? If they think, okay, I think I'm ready to start thinking of myself as a leader, like, what's the first thing you would tell them to start? Like, where did they start from?
Are you saying in terms of just content or working with me?
Either way, like, I know, we talked about the working with you part. It's like, how do they even say, what do I do now? Like, I know I want to be a leader. I know we've talked, working with you, definitely a plus. It's like,
Mhm.
just say, okay, I don't know yet that I want to do like a full program, but where do I start from?
I would say that starting with the results, just you and yourself, like what impact are you trying to give as a leader? I think when people think of, leadership, they're thinking of their boss's role, right? That's like the most natural thing. I want my boss's job. And the first thing you need to do, though, is to ask yourself the kind of leader you're trying to be and the result you want to get. Are you actually sure you want your boss's job? Because that's really what's helped me. I never look at my boss's job as my next level. I'm
Yeah,
like, what result am I trying to get? And if my boss jobs aligns, most of the time it hasn't actually,
yeah,
believe it or not, because you're able to sit with yourself and say, what legacy do I want to put out there?
yeah,
Because that's where the meaningful work starts from. Then the second thing I would do is once I define the result I want to have, is find one or two people to connect with. And I like LinkedIn a lot because you can really see people's profile, you can see what they've worked with, who what positions they've occupied and where they're going. So get on LinkedIn and find one or two people to connect with and just set up a meeting, have a chat with them. You don't need a program for that.
yeah,
Some people may struggle with the, networking thing, but even if it's an old med school colleague that they're usually very happy to reconnect with you.
yeah.
So know the kind of leader that you want to be in terms of impact, not title, and then find one or two people to connect with. Those will spark your juices. They'll get you thinking about, I like how you do things. This is different. I could do this. I could not do this. And don't limit yourself to your clinic or to your hospital.
Yeah.
Don't do that because scarcity mindset will make you struggle as a leader. You must think about the global world as your opportunity.
That's your stage. Yeah.
Yep, absolutely.
Awesome. Now, is there anything that you think we did not cover in terms of physician leadership that you would like to, like some parting words you like to, give? I think we pretty covered most of it. What I think, of course, it's exhaustive. I mean, you're on a
It
course, so you know
is.
how exhaustive So we definitely cannot get into everything at this time. But is anything else that you think we needed to know regarding physician leadership?
I will say the biggest thing is find find a medical student to mentor. Um, the best way to take medicine back. And I'm not trying to say that I'm running a revolt here, but the best way to not abandon what you worked hard for is to keep a culture going. So find a medical student to mentor so that we don't get to a point where all our narrative is that medicine is done and over with, because that trickles down. I know most physicians don't want their children anything close to
Absolutely. It's
medicine.
like, yeah, you want to do medicine? No, turn the other way. Go to tech.
Correct.
That's where the
So
money is.
we need doctors.
We
We
do.
need doctors to do their job and love the job and be able to do it well enough to pass on their knowledge and experience to others.
Absolutely.
And even though we're in the days of AI, that AI can pass USMLE 1, 2, 3, you're human.
Yeah.
And that human touch, the pendulum will switch back, and we're going to need that. And a medical student making a decision today, thinking medicine is done, they need someone like you to remind them that medicine is not over with. We're part of that journey. We're together. So find a medical student to mentor, find people to impart and tell them that medicine is not done. We still need the human touch in medicine. We just need people who understand their roles as leaders within the community. And we're not taking a backseat anymore.
Amen. I almost said it hallelujah with them. It just an amen almost left my lips right now.
Yeah. I definitely understand, but I don't want to lead a revolt, but
Yeah.
identity is a big part of the title we've been given.
It is, absolutely. Well, thank you so much, Dr. Peju. It's been a
Thank you.
pleasure talking to you today. Thank you for
Absolutely.
sharing your story and your journey. And I'm hoping, like I said, that folks who listen to you today, I know they're gonna have something's gonna click, like that light bulb is gonna click, and they would know the roles that they are built for. And like you said, it's all about knowing what you can bring, and it's a lot as physicians. I mean, it's a lot, but we've limited ourselves for so long. And I'm hoping that through, conversations like this, we can finally step into the limelight, so to say. So it's been an absolute pleasure, and
Thank you.
hoping to connect with you sometime down the line. So if you enjoyed this episode, please make sure you like, share, and subscribe. And if you know a physician who wants to share their own story, we are absolutely open to these conversations, so that we, through our stories and our experience, we can become our physician's keeper. And you've been an awesome physician's keeper today, Dr. Peju. Thank you for sharing your story, and we'll see you at some other time.
Absolutely. Thank you so much. Have a great day.
I hope you enjoyed today's episode. Please like, share, and subscribe, and invite your fellow physician to come join this amazing physician community. See you next episode. Thank you.